So they wanted all this, and they thought, we don't have any other leverage point. Let's create a leverage point. Let's shut down the United States government for the longest shutdown in American history, 41 days. And that's exactly what they did. And Richard, I did, thanks to, and I will give credit to a writer at the Federalist that I admire a lot, who did a deep dive into the numbers and said, well, what awful things are going to happen if these expanded Obamacare subsidies disappear? 75% of the people on Obamacare who enjoy it today will have to pay more. Do you know how much the average more is for 75% of them? $62.50 a month. Now, is that inconvenient? Yeah. But right now, Obamacare expanded subsidies are paying almost 90% of the tab. So, in other words, the government is going to pay for almost all the health insurance. I got to tell you, Richard, my health insurance, and I don't go to the doctor very often. I get a checkup twice a year because I've got diabetes. But other than that, and I get a couple of meds that cost about $10 because I got slightly elevated blood pressure, mostly because of the Democrats.
I can't
imagine. And I got a blood sugar problem. But other than that, I don't go to the doctor much. So the company I work for pays about $15,000 a year. Tina and I throw in another $5,000 or $6,000 a year to cover us for health insurance, and we're paying for all those illegal aliens you see in the. And I know I've kind of rattled on, but if you drop from 88% of health insurance is being paid for by the federal government under Obamacare to 78%, is that a big catastrophe worthy of shutting down the government?